The first step of your 5-step treatment is performing a cleanse with a non-active cleanser. This is going to be citrus gel cleanser, foaming peptide cleanser, or creamy milk cleanser depending on your client's skin type and conditions. The second step is cleansing with an active cleanser. This could be beta green tea, rosemary herbal cleanser, skin brightening cleanser, pumpkin cleanser, or Maui cleanser, once again depending on the skin type and conditions.
Okay, so I'm gonna wipe the lotion on her face, but if you watch my application, this is the same application that we would use for an acid. So I'm wiping it up on the forehead and I'm not overlapping at all. And then I'm gonna go across the cheeks without overlapping. And we're using the gauze, so it's got like more space in between all the little fibers to catch things in. Oh yeah, you could degrease with cell conditioner, acetone.
And acetone.
Okay, so next step is Microderm. So I did a 200, I think, no, 220, just because I didn't want to be that aggressive on her. This is probably enough suction too. How does that feel?
Fine.
Okay. So my big thing about Microderm is you need to hold the skin as tight as possible for every step of the way. And then do not overlap. So this is only one pass because we're going to do an acid afterwards. You can't go all willy-nilly with it. Like you got to be in exact lines and no overlapping. So notice how I move as I go with my hands to stretch the skin. And Microderm should really take you no time. So notice how sometimes like I'll go like this and I'm using my pinky that's holding the Microderm machine to pull the skin tight. So you can play with it and see what works for you. But like right here, I can't really do this, right? So I'm gonna have to get creative about how I stretch by pushing her nose aside and then getting in. I'm gonna do her nose. You don't need the baby ones to do the nose. They're nice, but you could do it with the big one. Okay, so there's the Microderm. Now we're gonna do the Derma peel. So I think I told most of you when you use this, I like to do this in 4 parts. So I do like 1/4 of it on the forehead and move it around till it pills. So it has kind of a normal way that it works. You'll feel it be kind of jelly when you start, and then it gets really oily and slippery, which is where it's at right now, and then it starts to roll. When you get to the point where it feels oily, you know it's about to happen. There you go. So can you see it start to get kind of flaky? I don't know if you can see that from far away. I do it in sections. So I'm going to do that. And then I'm going to do the cheeks.
It may take a few minutes for your derma peel to roll up, so don't freak out. Just continue to roll And at some point, you'll see the little flakes that let you know that the Derma peel is ready to remove.
Okay, now for the acid. So your acid, you're only gonna do 1 layer, and we're doing the lactic acid. Oh yeah, you should always wear gloves when you're doing the acids for sure. Really any form of exfoliation, because if you're doing facials all day long, even doing scrubs, your hands will feel terrible at the end of the day. Like, I would put your gloves on before you do your exfoliation and then wear them all the way through extractions. And then if you're working somewhere where they don't require you to wear gloves, then you can take them off. Okay, so I have my acid on there. I put it on, so you'll get it like put on top of your gauze. And then you should take the gauze and squeeze it. So I don't want to do this over her face necessarily, but I want to show you. I put it in the middle and then I take each corner and fold it in to get it fully saturated like that. And then I take it and just squeeze it out over top of your acid bowl. So don't do it over the client. Like I said, don't do it over anywhere else that you might potentially use in the future. Like you want to do it just over top of that acid bowl. And then we're going to do our 1 layer of acid application. So starting on the forehead, I'm going to apply straight up and stop. And you can go all the way into the hairline if you want. You can do the nose now or last. It doesn't really matter as long as you have a pattern and you're not overlapping. And I find that the cheeks are the most common place that people overlap, actually right here, because here, turn your head really quick. What people do is they go like this and curve up, and then here, and then curve up. And see how I would be overlapping here a bunch of times? That's going to be multiple layers of a chemical peel. So you have like more of a likelihood of her scabbing in that area or frosting or anything that could possibly go wrong. So we want to make sure you're going straight. And then her chin, I'm actually going to do going down. And then the top of the lip, I fold it like this, and I'm just going to go on each side. I do sometimes have them tuck their lip in, but what I find, go ahead and tuck in your lips, Michaela, is when you do that, it opens up the nostril and you have more of a chance of getting the peel in the nostril. And that really hurts. So I've kind of stopped doing that. If I can get in there without them making the pursy lip face, then I will. So now that I have acid on my hands, I need to choose a side of my towel, and that's always going to be my acid side, and I'm not going to touch it again once I don't have acid on my hands anymore. So what I'm actually going to do is I'm going to flip my towel after I wipe it. And I'm going to put that part inside and use a new side of the towel. The other thing you have to be careful of is after you've touched the acid with your hands, you don't want to be like resting your hand on their head. So you're going to have to like rest the back of your hand. And you can also use like the sides of your hands here to move their face. You don't want to be like grabbing their face when you have acid on your fingers. And then what was the other thing I was going to say? Oh, you have to switch hands. So when you're doing your acid application on this side, you need to use your left hand. You just can't get in there. See how that doesn't really work? You have to use like that to get the good application. So just be aware of that. Now, if I was doing another layer, let's say we were doing a different peel and this peel had multiple layers, then the next layer I would do in a different direction. So we would actually go horizontally here and then vertically here. And you could go up or down. Usually people like to go down because it reduces the risk of touching the eyes. The other thing you always wanna tell people when you start doing a chemical peel is to keep their eyes closed the whole time and don't talk unless you're asking them questions, because 'cause they'll be like this moving around and their eyelashes are opening and closing, and especially with her, her eyelashes are long enough that if she were to, like, look up at me, for example, like, I ask her a question, she tries to look at me to answer, her eyelashes will actually touch the chemical peel that's on, like, right above her eyebrows, and that's not good. The other thing I've had people do is when they go down the center, this has been done on me. So they go down the center, and instead of folding it and going like this, see how that fits there? They do this. And then guess what happened? I got peel on my eyelids. So, not the end of the world for me because I'm an esthetician, but for a client, they're probably not going to be very happy about that. And then you tell them not to touch anything. So, a few other things to look for when you're doing chemical peels. You want to ask the client what their sensation is like. So, do you feel anything right now on your face?
No.
Okay. I usually start like that. Are you feeling anything? And if they say yes, I ask, what does it feel like? I'm not going to ask them, do you feel any burning or do you feel any stinging? Because then they feel burning and stinging because it's in their head. So I ask them, what does it feel like? Can you explain the sensation to me? Or maybe ask them, what's your sensation rating if you were to give it like between a 1 and a 10? And you want to give them some frame of reference. So usually I tell them like 1 is nothing, 10 is it burns and you want it off right now. We don't want people to get above like a 6 in like a really strong peel.
I think it's glycolic that like makes you feel like you need to just rip your like scratch.
Yeah. Yeah. And then you want to make sure that they know, like, don't touch anything. If they feel sensation and you want to know where it is because you're going to do something to help to stop it, then you want to make sure to ask them, can you tell me where it is? And you don't want them to show you where it is. Because I've had people do this before. It's right here. And then now they touch the peel and now they need to neutralize their finger because they have peel on their finger. So if she was feeling sensation, I would say, can you explain to me where on your face you're feeling it? And then if she were to say her cheeks, then I would go in and just do some tip ointment. So this is just kind of like nerve blocking, like tricking the skin into not feeling the sensation. It doesn't make it go away. Some places will use fans. I am not a fan of fans because I feel like they actually make it worse. Like it actually spikes the sensation. So this to me is much better. Sometimes though you're doing a peel where like you can't do this, like a TCA peel, you really can't tapote it. So for that, a fan is the only option. So we're gonna rinse and remove, and I just have my wet SD wipes, and you guys would do the same thing. So in the spa, no hot towels on peels ever. You need to use something cold, or not cold necessarily, but cool and soft. So I'm gonna use the SD wipes to remove. And this is something where I would probably remove 3 times, just I hate the arbitrary number, but at the same time, it forces you to continually remove so that you know that you're getting everything off. Sometimes when you're doing a peel, though, you'll have a solution that actually has a neutralizer with it. So then you would be neutralizing instead of rinsing and removing. And if she got to the point where she was like, this is terrible, I can't handle this, it needs to come off, I'm burning, then we would actually make like a baking soda and water mixture and use that on her because that will neutralize the peel right away. And if you guys do use peels with neutralizer, you do need to know that when you neutralize, the sensation will spike. So if somebody's feeling something, you put the neutralizer on, it feels stronger for a few minutes and then it wears off.
Yeah, like I can feel something now that I did what even when it's just a peel.
Uh-huh. It's the change in the pH is what they're feeling. So as the water's changing the pH of the acid, she's feeling that on her skin.
At this point, you're going to apply any building and strengthening product that you choose. Remember, these are not active and don't contain acids, so they're perfectly safe after this treatment. Then follow with any mask of your choice. Milk mask is always a safe bet on skin that has just had exfoliation because it's refreshing and cooling and it helps with inflammation and redness. At this point, you can perform some massage on the neck and décolleté, make sure that the client is feeling relaxed. And remember that we never leave a client when they have a mask on, so you have to do some form of touch therapy, whether it's working on the chest and the neck and the back of the shoulders, or working on the scalp with a little scalp massage, or rolling over your mask with cold rollers, or doing a hand massage, anything that you can do to relax the client and give them a full experience without walking away from them. After removing your mask, you're going to apply some finishing products. So this could be cucumber spritz, followed by any building and strengthening product of your choice, and one of the moisturizers and hydrators. And then, of course, follow up with a nice layer of sunscreen to protect your client after their exfoliation.